Hello, welcome everybody. And bon appétit, I hope. First, we wanted to thank you very much for accepting our invitation and for joining us today for the second education session presented by the HNHB French Language Services Community of Practice. My name is Annie Boucher, and I am Health Planner for the French Language Health Planning entity for Hamilton, Niagara, Haldimand, Brand, and Waterloo, Wellington. You will hear me talk about entité, entity, entité deux. We use those interchangeably. I am here with my colleagues Bianca Gagnon and Olivier Lechat. If you didn't get a chance to take part in the first education session that took place in December on the Translation Network Services, you can access the recording and the presentation on the Entity 2 website under the Community of Practice page. And before we introduce our guest speaker, Sylvie Sylvestre, today, let me take 1 minute to provide you a little bit of context. On how this initiative came to be. And as I'm certain not all of you are familiar with the community, the French Language Services Community of Practice, or with the French Language Health Planning entity. The entity is mandated by the Ministry of Health to inform planning and improve access to French language health services. There are currently 6 entities across the province, and to fulfill our mandate, we apply what we would call a 3-pronged approach. We engage, sorry, just a second, I think we're not on this. We apologize, 2 seconds. I'm not the most technically. Okay, sorry about that. So we engage with the Francophone community and the stakeholders. We provide advice and recommendation to support local and provincial planning. And we support providers individually in the improvement of their FLS capacity. So how the Community of Practice came to be. The Community of Practice was launched, The Community of Practice was launched in 2019 by the HNHB, LIN, and the entity to address identified knowledge gaps in terms of French language services, such as the requirements of the identification and the designation, but also in terms of available resources to support providers in developing their French language services capacity. The entity and the LIN have opted for a Community of Practice collaborative model with a steering committee composed of willing partners. The purpose of the COP is to create a structure that allows providers to connect regularly. It is also to provide access to resources, such as what we're doing today, to support knowledge exchange and to foster collaboration amongst providers. And general membership is inclusive to all. Fluid boundaries will ensure increased access to resources necessary for improved access to and delivery of French language services. And in order to make sure that what we're offering meets your needs, we will be circulating a survey following today's webinar to inform future planning of events. And obviously, if you don't want to be on the distribution list, you can let us know after the webinar by email or just by contacting us. Today's presenter, Sylvie Sylvestre, is a Planning and Community Engagement Officer with Réseau du Mieux-être du Nord de l'Ontario. And le Réseau du Mieux-être du Nord de l'Ontario, basically as a French language health planning entity serving Northern Ontario, and similarly to the entity 2, Le Réseau engages the Francophone community and collaborates with local and provincial partners to plan and implement services in order to improve access and bring equity to health services in French. Sylvie is with us this afternoon to talk about the importance of active offer of French language health services and to provide an overview of the interactive online training on active offer that was developed by the Réseau. We're very happy to have her presenting for us today. So without further ado, we'll turn it over to you, Sylvie.
Okay, thank you. I need to not see myself, escape. How do I do that? Okay, I want to go with my presentation. Can you see my presentation? I think so. Right?
Yes, we.
Okay, okay. Well, thank you for having me. Yeah, we responded to a need in our region a couple of years ago because we would support, like Entité 2, health service providers in the implementation of the active offer of French language health services. But what we were hearing in our region from health service providers was, okay, great, you're giving us the definition, which I will show you next. So we would go and meet and have some resources and explain that the active offer, the definition which we have taken from the Ministry of Francophone Affairs in the agency designation plan and evaluation tool, is that it's to offer proactively quality services that are available at all times. They're clearly communicated, they're visible, they're easily accessible, and they're the equivalent to the quality of services in English. So fine, we heard what the health service providers were telling us. Give us some tools, how to put it into practice. So hence came the project of the active offer training platform. So if you want to complete it, you see the links at the top, the domain name, so it's available in French and English. But before we go into the training and explain it, I just want to spend a couple of minutes talking about the positive impacts for the Francophone patients and clients of receiving French language health services. So, and this is all documented in research. And we do see and we do know that it makes it a lot more easier for the clients to be able to express their needs and to explain their symptoms, because we do know that when we are in a situation of stress, of vulnerability, we're in at the emerge, we often revert to our mother tongue. So it's really important for us to be able to have that ability to express our needs and to explain our symptoms properly. We do know as well that we have a better understanding of the treatment plan, and we will adhere to it instead of not understanding what we were told and the treatment plan, and then risking going back to the emergency, risking being rehospitalized for the same type of issue. We also see that there is a better patient experience and that the patients, the clients, are better able to manage their health. And the impacts, the positive impacts for the healthcare professionals is that what they are telling us, and also in the literature, is that their health assessment is more accurate when they're able to better communicate, ask the questions, and understand their patients, their clients. There is also a better opportunity to build a connection, an interaction during the treatment, and have more effective communication with the patient, with the client, and for them as well. Not only for the patient is there an improvement of patient experience, but also an improvement of the experience for the professionals. The positive impacts for the providers, for the health service providers, and for the healthcare system is that we do see increased quality, and big thing is the safety of care. It is a client-centered approach, and we're reducing the problems that are related to the service delivery and better able to manage the risk. And bottom line as well, there's reduced cost to the health service provider, to the healthcare system, because if the client or the patient is better able to manage their health, You know, they're not going to go back to emerge or being rehospitalized as they would if they did not understand their treatment plan and did not adhere to it. So for the active offer training course, some basic information. It is available in French and English. I do have to say that one of the limits to the current platform is you can't switch from one language to another. So if you start in the training in French and you're like, you know what, I think that I'm searching my words, I'm not quite sure what such and such word means, I want to go back and forth to the English, it's not possible. And if somebody has started in French, we don't want them to be discouraged that they have done 3 of the 6 modules and they have to start all over again. Give us a call. We can go in your account, register you to the other version, to, let's say in this case, to the English version, and we'll be able to tick off everything that you have completed so that it's not frustrating and you don't have to redo all of the hard work that you have done. It is a 5-hour training, so it's divided into an introduction, which is about 30 minutes, and afterwards, each of the 6 modules are about 45 minutes in total. So there goes the 6 training modules, which I will give you an overview shortly. It is geared towards individuals who are studying or working in the healthcare profession, but we've had members of the board of directors follow this training. We've had volunteers for health service providers, and the beauty of it is that it is adapted to the 6 regions in Ontario that cover the 6 health planning entities. So it really is geared to your reality, and what you're seeing on the platform when you're doing it for your region on stage 2 is that you're not going to see an example of, let's say, a website that is from Northern Ontario. You would see an example of a website from a health service provider from your area. Individuals can register for the training course, and I will show you in a little while how to navigate the system very briefly and how to register as an individual. But with this current platform, the beauty of it is that organizations can register. All we need is to have 1 or 2 administrators to manage the registration process, and to be able to import a list of employees and their email addresses. Let's say you decide we're going to start with the board of directors and senior management follow this training course. Well, all you need is to import the list, and we, the Réseau du Mieux-être, can help you with this if you provide an Excel template with your list of employees and email addresses. The only thing that you need to specify is in which language they would prefer to do the training. And if no language is determined, then all of the staff will be registered in English, but the email that they would receive from us would indicate that should they prefer to do the training in French, to respond to the email, and we will register them in French. And the beauty of this is, as the 1 or 2 or even 3 administrators can then monitor the staff progress and see where they're at, how many have completed their the 5 hours of training, or whether, you know, they've completed the introduction module 1, 2, 3. So when they have completed, they can print their certificate and it can go in their personnel file. Now you'll see on this slide, we're also talking about there's a possibility of obtaining continuing education credits, and I will cover that in 2 slides from now. So the training goals is basically to be able to discuss the importance of the active offer with individuals, like I said, who work or study in the field of healthcare, and to promote the important role that everybody I don't know why my connection is unstable. Okay. Promote the important role that everybody, we as individuals, can play to ensure ongoing improvement in the active offer of French language health services, and to support a safe environment so that we can provide quality care to our patients and to our clients. And when the training course was launched 2 years ago, we had worked with the Canadian College of Health Leaders so that the training course, if you were a member of this Canadian college, you were accredited 2.5 credits in the category 2. Since then, we have worked with the Northern Ontario School of Medicine, and the course has been accredited as well with members of the College of Family Physicians of Canada and the Royal College of Physicians and Surgeons of Canada. Now, there are other colleges that will accept. All you have to do is, I'm just saying this, if you're a member of the College of Social Workers of Ontario and you have to do continuing education, you can approach your college, hand in your certificate, and see if they will credit you your continuing education credits. Okay. Am I going too fast, or do I stop for some questions before I go into an overview of the training modules?
No, it's all good. No question.
Okay, it's all good. Like I said, the training modules are divided into 6, and I will very briefly go over them. So module 1, we are focusing on excellence in patient-centered care. So we do go over the general features of active offer, and I have to say that because we want people to understand the definition of active offer, what we have done is repeat it a couple of times, at least 3 times throughout the training. But we've made sure that people focus and read the information, so the layout of the slide is different. And even our staff at the Réseau had to go slide by slide and compare. I think this is the same definition that was in module 1 that I'm now reading in the second module, but the layout is different. So that's the only little bit of repetition that occurs in the course. So we do go over the best practices of direct services to clients because, again, the health service providers wanted specific tools how to implement the active offer and the best practices of visual identity and communication. And with those 2 areas, what we have done to present it, we've presented a summary table that you can actually print right from the training. There's a print button at the bottom. Health service providers, when we did the launch, suggested this, and because our course is like a living document, I don't know if I can say it's a living training, anyway, we added that feature so they can print it, and when they're meeting with their French language health services committee, or they're meeting with the upper management or with their board of directors and they want to improve, then they have a visual of what they want to discuss. And most of the training modules do end with a case study. So in terms of the second module, equity and safety, of course, we cover those 2 topics, health equity, the importance of French language services for patient safety, and again, we end with a case study. We found that in the case studies, we have some very short videos that can be from 30 seconds to a maximum of 6 minutes. And the comments that we have heard is that this is where people have benefited a lot in terms of hearing the experience of a patient or hearing the experience of a healthcare professional. I'm not sure how to say, the word is not coming to me, a témoignage. Somebody help me.
Testimonial.
Thank you, testimonial. So that really has an impact. So that's why we have added some videos, some case studies, but case studies as well in terms of having some self-reflective questions followed by the video, just to not watch a video, but to really think about it. But we don't leave people hanging and just ask them questions and answer them on their own. The following slide will have a series of possible answers. The third module on cultural competency covers the concepts of cultural competency and the importance of cultural competencies for Francophones who live in a minority context. And again, we end with a case study. The fourth module, and I'm sure that in your area, you know the French Health Network of Central Southwestern Ontario, who has developed the recruitment and retention of bilingual human resources course, also on an online platform. And we have worked with that network so that we can summarize it in 45 in a module that's 45 minutes to be able to pique people's curiosity, to give them an overview of how they guide HSPs in recruiting and retaining bilingual staff so that they can offer services in both official languages throughout Canada. Their training was developed for all of Canada, and I do highly recommend it. And we do add the link to be able to follow it. Our platform was developed for Ontario, but I have to say that there have been people who have taken the course from outside of our province, and us as well outside of our country. And we are now in the process of developing a generic version so that other provinces don't need to follow all of the information about our laws and regulations with the Ontario government for French language services, but it's more generic. And now we're adapting it to other provinces and territories. I think we're going to be adapting it to 6 other provinces and territories from now until the end of April. Module 5, we're looking at the work environment and the organizational culture, and I will go over what the key roles are of the key partners in the implementation of Active Offer. So it's a lot about developing a bilingual organizational culture, which is very important so that the employees feel comfortable working in both of official languages, working side by side with both populations, all populations, and when a patient or a client walks in, they can also feel it, that they are walking into a bilingual organizational culture. And we end this module with the planning and implementing French language health services. Again, a lot of the tools, the resources that you can put in place. And the last module is all about community engagement, because we all know that health service providers have to do some community engagement, but they've often asked us, well, we need help. How do we plan community engagement with the Francophone population? Because the reality is oftentimes it's a small proportion of the population. They're often asked to participate in this and that, and we often go towards them, and they want to feel that they're participating, that they're valued, but that they're not just consulted, but that what they are bringing to the table, what they're recommending is incorporated into the strategic planning, into the committees and so on. So we do give examples, concrete examples of community engagement with the Francophone population. So before I go into the next section, which is the key roles of the key players in the implementation of active offer. Are there any questions or comments?
I don't see any questions, Sylvie. I'm just having a quick look.
Okay.
I don't think we have any questions. I don't know if you want to wait a couple of seconds to see if...
Sure.
No, I think we're good.
All right.
And I forgot to mention this at the beginning. At the bottom of your screen, you have a Q&A button that you can click on if you want to ask a question at any time to Sylvie or to us. And we'll answer them as we go or at the end of the presentation. So I don't know if your screen looks like mine, but that would be the second button to your left.
Going once, going twice. Keep going.
Yeah, we're good. Thank you.
Okay. So we often also do presentations to not only health service providers, but to the community members, to Francophone organizations. And oftentimes they want to know, as a Francophone, how can I promote the active offer? So during those presentations and different committees, we give as well some concrete tools and explain that we encourage people to identify themselves as a Francophone when they're registering. Let's say, I'm just taking an example, at the hospital. So upon registration, do identify yourself as a Francophone and to actively use French language health services. If you need to fill out a patient satisfaction, a patient experience survey, fill it out. You know, if it's available in French, fill it out in French. If there's questions, and we encourage health service providers, well, the designated health service providers do have to add questions to evaluate the quality of French language services that they have delivered, but do take the time and, you know, not only note what didn't go well, but to also provide some positive feedback. And to participate in the planning and governance of agencies, we often hear that it's a challenge to recruit the Francophone community to sit on the board of directors. So we often have health service providers who come to us, can you help us out with this? Can you advertise in your social media? Can you advertise in your committees, in your information bulletin that we are trying to recruit Francophones to our board of directors? So we do encourage our Francophone population to get involved, to participate in the planning, into the governance of agencies. As a healthcare professional or as an employee, the role in the promotion of active offer is to greet clients with a bilingual salutation. Hello, bonjour. And, you know, I'm wearing my pin here, je parle français, but oftentimes we do get comments that, you know, it's magnetic, we lost it, we put it in the washer, in the dryer, and we lost it. And so we often say, well, hello, bonjour doesn't cost a thing. You can't lose it. So if you can implement that, that's a very easy way of greeting your clients and to continue the conversation in French if required. It's very important that the French-speaking staff identify themselves as being bilingual, whether it's a pin or I have here signage where you can see welcome, bienvenue in this location. Services are available in both French and English. Ici, nos services sont disponibles en français et en anglais. So, in understanding the needs of Francophone as a healthcare professional, as an employee, to redirect Francophone clients to Francophone professionals or employees. And at one place, I did see that the staff had created at the front desk had created little cheat sheets with short phrases where they could greet people and ask basic questions if the person continued with the French language, and then they were able to read something like un moment s'il vous plaît, and be able to go and redirect to Francophone professionals. And as a health service provider, the role in the promotion of active offer is to include the Francophone community at the governance level. And like we were saying, my réseau or Entité 2 can certainly assist in helping out with this. One of the roles is to develop a policy on French language services or on active offer, and to have a section in your HR policy for French HR, is to engage the Francophone community, to integrate it in your strategic planning, like I said a little while ago, and to continue to plan, to coordinate, and to assess French language services with the resources that are provided to you. So in this case, for you, it would be Entité 2. So before I go on, I just wanted to mention that my presentation as well, I did share it, and Entité 2 can share it, but I had it in French and English, same information. But if you prefer to have it in French, it will be distributed to you. But before I go on to navigate a little bit of the platform, I can stop here and see if there are any questions, comments.
I'm just having a quick look, Sylvie, and I don't see anything. Again, at the bottom of your screen, there's a button it's a Q&A button. If you click on that, you can ask questions to Sylvie and to ourselves. And like Sylvie was mentioning as well, if you want to look at the presentation after, it's going to be available on the Community of Practice webpage. That's hosted by Entité 2. But at this point in time, there's no open questions. Maybe I'm just going to take the opportunity to leave people to give people a little bit of time. I'm just going to take the opportunity to mention you were showing like the sign.
I was showing the sign. I forgot you can't see me.
Yeah, we can see you. No, I just wanted to say, because we can see you, but I just wanted to tell you that I just wanted to let people know that we actually have a sign that is available that we can provide to providers for free with a little stand, and it's white and green. It's very nice, and it says, you know, services are available in French here, or do not hesitate. I'm sorry, I apologize, I don't remember exactly what the sign says, but you can contact Entité 2 and we will provide you the sign for free if you wish to post that. It can actually stick on the wall as well, or it can be on a desk on a stand. So we do not see any question. Oh, there's one question. Yes, we will. So Joanna was asking if we are going to post the Community of Practice link. So the web page where all the information is available, and like I said earlier as well, you can find the previous webinar that we had in December. The recording is there already, and this webinar, including Sylvie's presentation, will also be there. It's a tab on the Entité 2 website, but absolutely we will be posting at the end of the webinar, we'll be posting the information. Thank you. There's no other question.
Okay, and I just realized that I skipped my last slide before my conclusion. I wasn't done with the role of active offer in for health service providers. Just to end, it's the role is also to recruit and retain bilingual staff, to create your internal culture that promotes the active offer. Like I said, it's very, very important, not only for the staff, but for the patients and clients walking into to feel that they can access French language health services. It's also to increase the awareness among the employees of the importance of French language health services. So we do hope that the training course will be offered, and I'm sure it's offered, but taken by employees. And to provide the training on the legal requirements of French language services if you are a designated agency. And it also empower the employees in the implementation of active offer. And that is it. So I will just show the end of this. And so if you need more information to register your organization, at the end of my presentation, you have my contact information. And from there, if it's okay, I would just like to show you very briefly the training course. Can I go on with this?
Absolutely.
Okay. Yeah.
Can I ask another question quickly? Can you speak quickly to the fact that how critical it is that different levels of, or different people within the organization that have different roles do the training? You know what I mean? That it's not necessarily just relevant for bilingual front staff, but also for human resources personnel or managers. And I think, in my opinion, I think active offer has a chance of success if all those levels are engaged together at the same time. So I don't know to what extent you would agree with that, and what would be your recommendation?
I totally agree that everybody in the organization should take the course. And it's not just for people who are unilingual English, but oftentimes I have to say that even the French-speaking people need this course, because we have seen too many times that the French speaker will hide and will not let people know that they can provide services in both official languages. And for different reasons, it can be that they feel that they're going to be asked more often to have more of a workload. On top of the workload that I have, they're going to assign me other patients, other clients, and I don't have the time, so I'm not going to let anybody know. Oftentimes they said, yeah, but they keep coming back and saying, well, you know, can you translate this document? And they're like, well, no, I can't, but it's a little bit hard or intimidating, and they don't feel comfortable. So these are all aspects of the training course that can also help them come forward and saying, I can serve in both French and English. I'm not going to hide anymore. And if I'm asked to do a translation, I'm going to say no. As an identified health service provider or as a designated health service provider, we have access to a free translation service. So encourage the manager to take advantage of that. So these are all examples that it's not just for one population or the other, but it's for both French, English. It's for, like I said, for everybody, whether it's a volunteer and how they can greet people at the reception. It's for managers, frontline staff. You know, we often see as well in long-term care, the kitchen staff, the dietary, the housekeeping, the maintenance have to deal with unilingual residents. And so they need to also have some tools to be able to service better. And finally, we often do presentations at the college and university level and encourage students to do the course so that they can put it in their resume and bring their certificates to an interview and saying, look, I've already completed this. You don't have to I don't have to take 5 hours of the time and in my day at work to complete it, it's done. So it looks really, really good on a resume during an interview. So we do work with many, many colleges and universities, whether it's, you know, a French college, bilingual English, our presentations, all of our material is available in French and English. Does that help?
Yes, absolutely. I just wanted to specify, though, before the translation network is flooded with requests, that unfortunately the free translation that Sylvie is referring to is, like she was saying, for designated and identified agencies, which is not the case for all the agencies that are taking part of the webinar today. However, we know that Louise Bayargent, who is the director of the network, will, and I'm talking about the network in our area, Sylvie, obviously, in the north, it's a different network, but the translation network here, she will gladly direct you. She has a list of vetted translators, and so she can assist you. But as far as the big free component, that is for designated and identified agencies. Just a clarification.
And we should clarify that the documents for the ministry-funded translation service has to do with the general public, something that is distributed to the general public and to your patient's clients. It's not, if your internal working language is English, your policies and procedures are not eligible for translation. And you don't need to translate your policies and procedures. But for your pamphlets, for your admission forms, those are things that are eligible for the translation service. And it's very detailed. Everything is outlined, what's admissible and what is not.
And again, that information is on the COP, the Community of Practice webpage. Okay. So you can go there, and all the requirements or the criteria are listed there. So back to you, Sylvie, sorry.
Okay, I'm going to share my screen again. Can you see it? Oops, wait, I don't know what's happening. I think I need to go here. Oops, partager. Can you see the platform right now?
Yes.
Okay. So the platform basically looks like this. You know, we do cover that you can get your 2.5 credits with the Canadian College of Health Leaders. There's a basic welcome, the training courses, the 6 modules, and so on. And the tabs, I'm going to go very quickly over this. The About tab, I was in the About tab. We have a Testimonials tab. We're very proud of it, of course. We're always looking for more testimonials from some of our users. And like I said, it's a living course, living document, so it's updated on a regular basis. Tab for frequently asked questions. I do encourage you to go over this tab before you start. A lot of very good information, because some people have said, well, I started on the old website or old platform. Do I have to start over again? No, contact us and we'll see what you have done and transfer it to this new platform. You know, do I have to renew my certificate after a certain number of years? No, your certificate doesn't expire. What's the cost? The cost, there is no cost, it's free. Okay, and so on. So, and then what we do say is, if when you're registering, if you're having some difficulties, don't waste any time Don't waste an hour trying to figure it out on your own. We've had that a couple of times when we launched this new platform and people were frustrated. Just stop and come and give us a call. Our phone number is there, or send us a message and we will respond to it. So I wanted to show you, I think I have to go back in the dashboard. I'm hoping that I can do this. I'm not in the right one. See, I'm in my training course that I've completed. So you can see that I can actually print my certificate right here. I've completed the course. There's my name. I completed it. Oh, geez, I completed it on January 22nd, 2020. And then just go back. And the discussion forum here, I just have to say that it's not to ask a specific question, you know, I'm struggling with such and such a module. It is for discussion. And this was added because of the two colleges of physicians and surgeons. They needed a place to have a discussion forum, and other health professionals have told us that it's been very valuable. But I will change. Okay, you can see. Can you see that I'm about to register here and add a username? Yes.
Yes, we can.
Okay, so I'm just gonna go my username. I'm not gonna sign in as Sylvie because that's already used. So I'll use my middle name. So I'll go with Jose, my username, and then I will write jose@imfno.ca. My name, whoops, Jose Silvestre, which is actually my niece who just moved in the Niagara region. And then I'm going to choose my region because I'm hoping I can do this. I want to go in the Waterloo, Wellington, Hamilton, Niagara, Haldimand region. And it's not, oh yeah, there we go. So I will choose my region. Like I said, it'll be the information that pertains to your area. And I will just do IMFNO 2020. So, and IMFNO 2020 and submit. I should be able to enter. My username. I can't use an accent on my name. So I'll just change that and go back to submit. Jamais. Am I logged in? Ah, okay, yes. 2020, log in. Oops, I didn't do something right. There we go. So, brand spanking new, and there's only one registered. I mean, I'm sorry, I think we didn't do the correct translation. It should be registered training and not registered formations or formation, but we'll rectify that. So, and you do have your course progress right here in the corner, and the terms and conditions, the disclaimer. And the one thing that I have to tell you is that you can't say, oh, you know what, I'm really interested in module 4. I'm going to start with module 4. Unfortunately, with this platform, you can't do that. You have to go one by one in the order that they're introduced. So you do have to start with introduction. And it does say it'll take you about approximately 3 minutes. So here we go, we start. And after each slide, you do have to click on Mark Page as completed. And you will see at the bottom, there's a little green dot, so there's your page progress. And it's as easy as that. And like I said, it is meant to be interactive. We do have, when we cite a source, you do have the source and you have the hyperlink to be able to go to it. Okay, and we were citing a report, and we can just go back and back into the training course. And you can see now I've done 2 pages and I keep going. So you will start seeing the little, you can hardly see it, but the course progress here, you can see that we've done 5 out of 388 steps that we have completed. So, and it'll progress to more and more green. So I don't, oh yeah, I was going to say I don't want to take too much of your time because I'm mindful of the time. But as you can see here, instead of my réseau's information, we want to guide you to your resource. So the information, because I chose your region, the information is about the Entité 2 and their phone number. So I'm not going to take more of your time, but I do want to, some of the highlights is that, like I said, there's some videos. When we go over some of the best practices, there's a soundtrack that plays, and the soundtrack can be as short as 15 seconds to a maximum of 30 seconds. What else are some of the highlights? We do have evaluations at the end of each module because we want to make sure that people didn't just go, mark pages completed, mark pages completed, mark pages completed, but that they did actually read. So there's an evaluation at the very end, which I can actually show you on, I don't know where. Wrong one. On my own dashboard. So if I was to go on my own that I've completed, I can access all of the content. When you do end a the entire training course, or after each module, we do ask for some global feedback in terms of the learning objectives, the perceived bias, and a little bit about you. We want to learn, are you a healthcare manager, a physician, a teacher, a student? Where are you from, the country, and so on, just to have a little bit of information. And what resources were helpful so that we can continue to improve the online training course. And just going back to the previous modules, if I was to take module 6 and, whoops, I just wanted to show you, it's not working. Yeah, go ahead.
There's a participant that clicked on the raise your hand button.
Okay.
But unfortunately, we cannot allow you to speak, not because we don't want you to speak. If you could just ask your question through the Q&A button. Olga, I'm hoping you can hear me. And if you can just type your question through the Q&A, that would be appreciated. Hopefully, Olga, if you have a question. Oh, we did get a new question. Is there a timeline to complete these modules? That's a very important question that we didn't address. And Joanna's asking if there's a timeline to complete the modules.
No, from our end, there is no timeline. Once you've registered, you have your username and password, you're all set up, you can access it anytime, anywhere. I forgot to mention, you can access it even on your tablet, your iPad, you're sitting on your couch and you want to do a module, go ahead, be comfortable, do it. From our end, there is no timeline. For some health service providers who have mandated it for their employees, we've heard that they have implemented a timeline, but not from our end.
Thank you. Olga, I'm hoping if you cannot ask your question, I'm hoping that I can answer your question when we see each other at the Niagara, Ontario Health Team. And don't hesitate to reach out to us or to me, and hopefully we can answer your question. I apologize for that.
For me, you know, that pretty much wraps up. I don't want to take more time. It's the platform is user-friendly, but again, if you're having problems, don't waste your time. Contact us right away. We encourage everyone to complete the training course. We like to see healthcare professionals, students show up with mention of their the course in their resume, they're presenting their certificate at an interview. So thank you very much for the invitation. It really was a pleasure. And I look forward to going in your area at the end of April. I'll be going to Niagara and Welland to visit family, and thank you again.
Give us a call.
Oh, yes, I could go for a visit.
Okay, thank you very much. We have Joanna who's thanking you very warmly. She said it's been very informative, and she's looking forward to share the link with her colleagues, which reminds me, as we said, I'm just going to quickly go back to our presentation, and on your screen right now you can see the link to the so on the entity 2 entitésante2.ca, that's our website, and there is a tab on that website that's called Community of Practice. It's you have the name in French here. I am not certain if there's 2 links, but regardless, we have the Community of Practice page is in English, mostly, for the most part. So this is where you're going to find these, you know, the recording for the webinar. Thank you very much, Sylvie. I see your face just appeared again. And that's where you're going to find that. You're going to find Sylvie's presentation and also Louise's presentation. And I just got an email from Louise explaining or clarifying to me that actually the translation network is a provincial network, and it's the same network with different teams locally taking care of the actual translation, but Louise manages the whole translation network. So thank you for that, Louise. Thank you, everybody, for participating. Again, don't hesitate if you have questions after the webinar. Our contact information is on our webpage. Like we said at the beginning, there's going to be a survey to see what has been useful, what's not useful, if you have additional questions, what we can do better, and what else you would like to see in the future for future education sessions. So thank you, Bianca. Thank you, Olivier, for making this possible. I can tell you by myself, I could not have done that. No one's going to argue. And I guess we're going to go offline and have a good rest of the week. Thank you.
And